You turn around in the kitchen and your hand reaches for the counter before you even think about it. You step off a curb and for 1 second you feel unsure. You get into the shower and lifting one foot suddenly feels more risky than it used to. Or maybe you are walking down the hallway and you notice your fingertips brushing the wall. Not because you are falling, but because your body no longer trusts the space the way it used to. And if you are over-lixid, the question is usually not, can I stand on one leg like an athlete? The real question is this just getting older, or is my balance actually getting weaker? Here's the truth. Balance usually does not disappear overnight. It changes quietly. A smaller step, a slower turn, a hand on the wall, a little hesitation before stairs. One of the most common things I hear from patients is not, "Doctor, I fell." It is, "I just don't feel as steady as I used to." One patient will say, "I'm fine walking straight, but turning around makes me nervous." Another will say, "I haven't fallen, but I keep reaching for furniture." And sometimes a husband or wife will say, "He says he is fine, but I can see him holding the wall more than before." That matters, because balance is not just a fitness skill. Balance is getting out of a chair safely. Balance is stepping into the shower. Balance is walking across a parking lot. Balance is turning your head when someone calls your name. Balance is being able to move through your own home without constantly looking for something to grab. Today, I'm going to show you one simple balance exercise in 3 versions: seated, chair-supported, and standing. The exercise is called the weight shift hold. You shift your weight to one side, you make the other foot lighter, and you hold that position with control. But the important part is not how hard the exercise looks. The important part is choosing the safest version for your body today. Before we practice, a quick safety note. I'm a doctor, but I'm not your personal doctor. I cannot diagnose you through a video. And this video is not for sudden symptoms. If you recently had a fall, or you have new dizziness, chest pain, shortness of breath, sudden weakness, numbness, trouble speaking, sudden vision changes, or severe hip, knee, ankle, or foot pain, please do not start with this video. Talk to your doctor first, and if you feel like you might fall while practicing, stop. Balance training should make you safer. It should not put you in danger. So, here is rule number 1. Do not practice where you have nothing to hold. Use a stable chair, use a kitchen counter, stand near a wall. Do not use a rolling chair. Do not use a chair that slides, and do not practice on a slippery floor. Now, let's decide which version is right for you. This is where many people get it wrong. They think the standing version is the real exercise, and the seated version is only for people who are very weak. I don't see it that way. If you were sitting across from me in clinic, I would rather see you do the seated version safely than force the standing version badly. Good balance training is not about proving you are brave. It is about giving your body a safe, repeatable challenge. If standing makes you nervous, if you have not exercised in a long time, or if you feel weak when you first get up from a chair, start seated. That is not a failure. That is a smart starting point. If you can stand safely, but you feel unsure when you turn, step into the shower or go downstairs, start with the chair-supported version. For most people, this is the best place to begin. And if you already stand and walk safely, but you want to improve your control, you can try the standing version. But even then, keep a chair or counter nearby. The chair is not a sign of weakness. The chair is part of the exercise. Let's start with version 1. The seated weight shift hold. Sit near the front half of a stable chair. Place both feet flat on the floor. Keep your knees about hip width apart. Sit tall, as if the top of your head is gently reaching toward the ceiling. Now shift your weight slightly toward your right side. You should feel a little more pressure under your right hip and your right foot. Then make your left foot lighter. Maybe just the heel comes up. Maybe the toes stay on the floor. That still counts. Hold for 3 to 5 seconds. Then slowly put the foot back down. Now shift your weight to the left side. Make the right foot lighter. Hold for 3 to 5 seconds. Then lower it with control. Do that 5 times on each side. Now, if you are already thinking, "Doctor, I cannot lift my foot," that is okay. then don't lift it yet. Just shift your weight from one side to the other. Let your body learn the motion first. Even seated, your body is learning something important. It is learning how to shift weight without panic. It is learning how your trunk, hips, knees, ankles, and feet work together. And for many people, that is exactly where balance training should begin. Now let's move to version 2. The chair-supported weight shift hold. This is the version I would choose for many beginners who can stand safely. Stand behind a stable chair. Hold the back of the chair with both hands. Place your feet about hip-width apart. Stand tall. Keep your chest relaxed. Do not lock your knees. Now slowly shift your weight onto your right foot. Do not throw your body sideways. Just let the right leg accept more of your weight. Then make your left foot light. Maybe the toes stay on the floor. Maybe the foot comes up 1 inch. You do not need to lift it high. Hold for 3 to 10 seconds. Breathe normally, then slowly place the left foot back down. Now shift your weight onto your left foot. Make the right foot light. Hold, breathe, then lower it. Do 5 holds on each side. The goal is control, not height, not speed, not proving anything. If your hand wants the chair, let it use the chair. I would much rather see a steady hand on the chair than a dramatic wobble in the middle of the room. If you wobble and touch the chair more firmly, that is not failure, that is feedback. Your body is learning where center is. Over time, you can make this version slightly harder. First, use both hands on the chair, then use one hand, then use just your fingertips. But keep the chair in front of you. I have patients who stay with this version for weeks before moving on. And that is completely fine. You are not trying to balance without help. You are teaching your body to need a little less help over time. That is a big difference. Now let's talk about version 3, the standing weight shift hold. Only try this if you can stand safely and you have support nearby. Stand next to a counter, a wall, or a stable chair. Do not stand in the middle of the room just to test yourself. Place your feet about hip-width apart. Look at one fixed point in front of you. Now shift your weight onto your right foot. Let the left foot come slightly off the floor. It can be very small. Hold for 5 to 20 seconds. Then lower the foot slowly. Now switch sides. Shift your weight onto the left foot. Let the right foot become light. Hold. Breathe. Then lower. If you are steady, you can gradually work toward 30 seconds. But 30 seconds is not required. I know some people hear standing balance and immediately want to close their eyes or stand on a pillow. Please don't start there. Closing your eyes makes balance much harder because your brain loses visual information. A soft surface also changes the information coming from your feet and ankles. Those can be advanced tools later for the right person, but they are not the starting point for most people. Good balance training should feel controlled, not dramatic. Now, here are the mistakes I want you to avoid. Mistake number 1 is lifting the leg too high. This is not a marching exercise. The foot only needs to become light. Mistake number 2 is holding your breath. If you cannot breathe while doing it, you are working too hard. Mistake number 3 is practicing with no support nearby. That turns a balance exercise into a fall risk. Mistake number 4 is using the wrong chair. No rolling chairs, no folding chairs that wobble, no chairs that slide backward when you touch them. Mistake number 5 is trying the hardest version first. That is usually pride talking, not wisdom. Start where you can succeed safely, then progress. So how often should you do this? Start with 2 to 3 minutes a day, 5 holds on each side, 3 to 10 seconds per hold, 4 to 6 days per week. If that feels easy and steady, slowly increase the hold time. Maybe 10 seconds, then 15, then 20. Eventually, some people can work toward 30 seconds. But consistency matters more than intensity. Small and consistent beats hard and occasional. You can attach this to something you already do after brushing your teeth, before your morning coffee, while waiting for the kettle, during a television commercial. The best exercise is not the one you do once with perfect motivation. It is the one you can repeat safely tomorrow. So here is the bottom line. Do not wait until after a fall to care about your balance. Do not start with the hardest version just to prove something. And do not practice where you have nothing to hold. Start seated if that is where you are safest. Use the chair if that is what gives you control. Try the standing version only when your body is ready. Balance is not about looking young. It is about keeping your choices. The choice to walk outside. The choice to step into the shower. The choice to move through your own home with confidence. 1 exercise, 3 versions. A few minutes a day. Start where you are safest. That is how balance begins to come back.